Welcome to another episode of the HealthCast. I'm super excited to have Jim Kaveney today. He is the founder and CEO of Unlimited Heart Health and Wellness. Welcome, Jim.
Thank you, Phil, for the opportunity. Looking forward to chatting.
Okay, let's just dive right into it. Tell us about your background, how you came to develop your company that Unlimited Heart Health and Wellness specifically addresses patients with atrial fibrillation.
That is correct. Yeah. So I come from it from a patient's perspective because I myself am an AFib patient. But prior to this as well, I was an entrepreneur. And so I started my own business in healthcare about 12, 13 years ago.
Yeah.
I was in pharmaceutical and biotech my entire career, all in learning and development. And then in 2012, I went and I started my own training business called Alchemy Partners. So that was my foray into entrepreneurship. So I knew I wanted to build something. But simultaneously, when I was building that, I was also diagnosed with my atrial fibrillation. And so my entrepreneur journey and my patient journey were intertwined. They became one. And so I learned to navigate the throes, the challenges of being an entrepreneur with also going through a serious dysrhythmia and trying to survive that and manage the business, manage a small family, et cetera, et cetera.
For people who might not understand fully what atrial fibrillation is, can you describe it for us?
Yeah. So simply put, atrial fibrillation is, the heart is made up of four chambers. The upper chambers are called the atria and the lower chambers are called the ventricles. And the atria up top, at the end of the day, it's just a quiver. In some cases, an exceptionally rapid quiver, and it beats out of sync with the ventricles. And so the biggest challenge for atrial fibrillation is one, the pacing is obviously very fast and can be very uncomfortable in people's chests. For me, it felt like a freight train chugging right through my chest all the time. But the biggest issue with AFib is stroke, because there are some things in the blood, because of the arrhythmia, the blood can pool up. And once you go back into normal sinus rhythm, that pooled up blood could have developed clots, and then off they shoot the clots off to the brain. You have a stroke, and it's really bad. And specifically, when I say really bad, it's actually 5 times worse to have an AFib stroke than it is a normal stroke. So that just puts into perspective how serious AFib is and why doing the right things to manage it is so important.
And you encountered this despite being, I think you're a pretty fit guy still and fit and an athlete throughout your life, and you still had this occur.
I did. And so I didn't realize it, but I was a walking risk factor. So I'm 6'6". And so I was also, I'm also a rower. And so I was a rower all through college. And so what was interesting for me at the ripe old age of 20, 21, I started having some instances when I was and for athletes out there, for non-athletes, pretty much everybody wears a heart rate monitor at this point, whether it's your watch or what have you. I would be working out at a normal steady state, and then I would see my heart rate go from 125 beats per minute while I was working out on the steady state to close to 200 beats per minute and not changing a thing. And so my coaches would come over and say to me, "What are you doing? Why are you deviating from the workout plan?" I'm like, "I'm not. There's nothing. I'm doing nothing different." And then within seconds, I'd go from 125, 130 to 180 to 200.
Yeah.
And then all of a sudden I would drop back down to 125. And they're like, "What did you just do?" I'm like, I didn't do anything. Right. So at that point, I was like, it's weird. I often joke, did I have a couple Budweisers last night before we got up the next morning to have practice? Who knows?
College kid. Yeah.
But then that went away. And then eventually over time, 16 years later, when I was 38 is when it came back with a vengeance. And now all of a sudden it just presented itself to me, out of sync. And then I was like, I ignored it because again, I was like 38 years old. Like nobody can take me down. I'm good. I know what I'm doing. But it wasn't until I passed out. I got up out of bed one morning to go work out, and I completely fell over. And my wife was like, "Did you just pass out?" I'm like, "I think I did." And again, being 6'6", going down, that and 215 pounds at the time. I mean, that's a big boy going down.
Sure.
And so then she's like, "All right, we're getting you in. Like, go see a doctor, right? Enough." And so that's what ultimately led to getting on the Holter monitors and realizing, hey, you have what is known as paroxysmal atrial fibrillation.
Yeah. So here you are, mid-30s, late 30s, 38, and you're a businessman, an entrepreneur in the healthcare pharmaceutical industry. And I think maybe you sold the company and now you're having somewhat of a health crisis, and you're looking to continue growing. You're still a young guy with your business and supporting your family, and then you have this health issue. And take me through how those things merged with your desire to grow as a business, and then this diagnosis.
Yeah. So I was treated here up in New Hampshire at Dartmouth Medical Center, wonderful physicians, and so I was under great care. But, obviously you have the struggles of trying to build a business too, right? So you have 15 employees, you got two young kids, and, my wife and I were actually working together, by the way. So I started the business. And then we started growing so fast that I pulled my wife in, who was an absolute operations genius. So she managed that stuff. But so the disease ultimately for me, unfortunately, started taking off even more and more. So was it the stress of the business? Probably. Everything else I tried to manage, I was on medicine. I had multiple procedures done. But just unfortunately, as the business was growing, so was my heart and my health was declining. And so it wasn't until probably 2018 in which things really started getting out of whack. My AFib had converted into what they call tachybrady syndrome. And so tachybrady syndrome is, again, tachy meaning the elevated heart rate. And the Brady part of it is when your heart just pauses because it's so tired. And I didn't realize, but I was maintaining my resting heart rate was probably about 140 beats per minute. And so that was resting, right? And so that was doing
Yes,
nothing.
sir. Pretty
Right. So
steep. Those you don't know, that's
yeah. And
triple, double the normal.
to me, I was learning how to manage it, but then weird things were happening and whatever. And so I finally went back to my doctors and they put me on a monitor. And that's when they said, hey, for the entire month of November, like your heart paused 68 times. Like that shouldn't be. And for 6 seconds at a time. So that's why what I was experiencing was, and the Northeast area, right? A lot of my business was not here in Massachusetts. It was down in New Jersey. So I'm driving on I-95 from New Hampshire to New Jersey, and those pauses are happening while I'm driving. So now all of a sudden, 6 second pauses while I'm driving on 95. You can only imagine what's happening, right? So you start to go down. It's like you're rapidly falling asleep. I joke about it now, but it was so dangerous. And my physicians are like, you could have died at any one of those moments. Like, you are so lucky to be alive. Let's fix you, right? We're going to put a pacemaker in, and then we're going to do another ablation. Ultimately, that led to me getting my pacemaker put in December of 2018.
Oh, yeah, that's quite a story. This diagnosis and these events, this changed the trajectory of your life.
Oh, without question, because for me at first, the AFib side of things it's okay. Like, right. I mean, it's the number one arrhythmia in the world. There's close to 60 million in the world. Most of them, by the way, are 50 and above or 55 and above, not 38 years old. But we are seeing a higher propensity of younger patients getting AFib because of elite sports, right? So for me, because my physician said, your only explanation for this is, one, you're tall, two, you're a rower, and you're exceptionally athletic. So that could also be the reason why a lot of younger patients that are marathoners or intense bicyclists or whatever, anything that elevates the heart rate to a consistent level way too much is not really, I mean, nobody's saying exercise is bad. Exercise is good, but too much aggressive exercise, that's when you start to get to the extreme levels. And that's where I fell into that pocket of those patients.
Yeah, as a collegiate rower, it sounds also like those athletes that fall into that category are inducing cardiac hypertrophy. Just like the way a bodybuilder induces hypertrophy on, say, biceps, that's what happened, and thus maybe the landscape or the area that heart is, and I'm just thinking out loud with you, but the area of the heart is larger, thus affecting the automaticity and the contraction of the heart.
100%. And it's interesting, right? There's been multiple books written about exercise-induced AFib and everything else. They have found that those patients, and when they pull the exercise back, their heart actually goes back to normal, right? So the substrate changes back again. Not that they can't exercise anymore, but they just can't exercise to the levels that they were. You shouldn't be maintaining a heart rate like 140 like for hours on an end. It's just not. It's not healthy.
Tell me in your journey, when did you become an author? Tell us about that.
Yeah, so what was interesting is, so my business, as I was saying, was growing rapidly. And so we started ranking across the country, and Inc. 5000 is one of the fastest growing training companies in the world. Excuse me, not in the world, would have been great in the world, but in the country. And so invariably people came out of the woodwork and said, hey, you're a business genius. You should write a book. And I'm like, not really. I'm just, my wife and I were just hard workers that just wanted to build something and do something different and better. And so that's what we did. I didn't see any kind of formula, so to speak, that anybody would want to read. So I'm like, not a good story. So I was pursued for about 3 years to write a book. And eventually I'm like, nah, I'm still not interested.
They came to you.
Yeah, they were coming to me. Yeah.
That's great.
And so the third person that came back to me from the same publishing company, she said to me, and she's a good friend of mine now, she's like, Jim, you should never write a book until you have a purpose. Just writing a book about your entrepreneur journey is not really that good. But if you have something that's purposeful, now that's a little bit different story. So I said, great. I said, I won't talk to you till I figure something out. And I gave up on the idea. But then I was hit by an opportunity. As I was reading another story. It was a cancer patient that went through his cancer journey and how he used his mindset to overcome. He ultimately succumbed to his cancer, but he lived it out in a way that was so beautiful, because the way he established his mind and the way he linked up his mind and his body so they could fight in as quality of a fashion as he possibly could. And it was amazing. And so he passed, unfortunately.
Is that when breath becomes air?
No, this is another individual called Trevor Moawad. By the way, Trevor Moawad's one of the best, or at the time was one of the world's best mind trainers or sports psychologists. And so I listened to his journey, watched his journey. I'm like, oh my gosh, I could literally rip out his entire oncology story and plug in my cardiac journey. And so I'm like, that's what I'm going to do. I'm going to write my story about how I used my mind ultimately, even when I didn't know I was going to get to it, my mind over my time, over my body, and came out of this on the other side of it. Because the key thing for me was when my heart was weak, my mind was strong. And when my mind was weak, my heart was strong. But when I got the two of those things together, it was like, man, okay, now we're going to go do something really, really cool and do this in a great way.
That's super cool. I feel like we don't want, and I have not read your book, but I've read about your book, just to be honest. But I feel like your story, the book overlaps with your business journey and your purpose. Specifically, some of the things that resonate with me were, and these are my own words, but maybe a challenging upbringing, and perhaps maybe I can tell as an athlete and a business person, you have a sense of drive about you. So maybe creating a sense of fortitude. And can you shed a little light on that for us?
Yeah. So, I mean, growing up in an Irish Catholic family of 11 individuals, me being the youngest of 9 kids, I mean, you learn to fight for your own, right? So, but no, it was raised in a loving family, driven by faith. I'm a faithful person. So I wouldn't be here if it wasn't for God. But, ultimately at the end of the day, I went through some struggles personally growing up as a kid. You go through all sorts of weird things, psychological things. But back in those days, in the 70s and the 80s, there wasn't really anybody out there to say, hey, here's performance psychology to get you through those things, right? I mean, you just didn't do it. And so I figured ways, I worked my own mind out on how do I get around these things. And so that ultimately drove a lot of what was helping me in the future. But before I go into this, I want to dive into what Steve Jobs once said. And Steve Jobs once said at one of his commencement speeches, he said, we never connect the dots in our life moving forward. We only connect the dots in rears. And so what that means, and what he meant by that, my interpretation of that was, you never know why you're going through anything in your life. You don't know what the value is. You don't know if it's going to be positive or negative. You just know it happened to you. But when I looked at, and I was writing the book, when I looked at the things that I went through in my life with my parents and my family, my own personal demons, those little instances, they ultimately were the things that made me into the stronger individual, so that 30 years later, when I'm diagnosed with my AFib, I could say to myself, I got this because I know how to manage my mind around these challenges. And so it was all of those experiences. My experience as a collegiate rower, which is probably one of the toughest sports you could ever get into. It's like, oh my gosh, if you want to have a complete mind and body kind of collision, it's it, right? And so all of those things prepped me for what I was going to do with my diagnosis. And so the book is really about my journey going through those stages of my life, leading up to that point of when I was diagnosed, how I managed that. And then now my whole point is, I didn't go through that pain for no purpose at all. I went through with an intention to say, I need to do good with this. And how am I going to do that? And that's why I launched Unlimited Heart Health and Wellness, is to make a difference in other people's lives.
I love that. I love that story. Sense that from you. I sense a drive and a sense of purpose. Tell us how Unlimited Heart Health and Wellness is impacting your, I'm not sure if you use the word patients or clients, but how are they impacting others' lives?
Yeah, so I mean, so our objective, and it's phenomenal, is what we're doing, right? And I'm not doing this alone, by the way. So I've partnered up with another firm called Nudge Health, and so Nudge Health and Unlimited Heart are strategic partners in all of these things. And so what we are focusing on is addressing the cardiometabolic challenges of all people, right? So individuals is as a whole. We don't call them patients either. We call them individuals or team members. But at the end of the day, our objective is to say, like I just talked to you about, how do we address the behavioral side of them first, and then figure out, okay, now let's go battle the physical side. Because if you're not willing to change, then it's going to be very hard for you to make those changes in your life. So let's boost up their confidence. Let's boost them up from a behavioral perspective, and then get them into some lifestyle changing happening. And that incurs diet, exercise, nutrition, things like that.
Cool. How long has this business been in existence?
So Unlimited Heart's been in existence for about a year and a half. But my business partners, Nudge Health, have been in existence for about 5 years. So collectively, we've treated close to 20,000 patients. We're connecting with private practices across the United States. We work with hospital institutions as well. And then we're also just working with a number of government institutions because what's happening in our marketplace now in healthcare, the system's broken. I think everybody knows that. And so,
Yeah.
CMS and the new administration's trying to say, hey, how do we go ahead and make some changes with this to make a difference for all of Americans?
Yeah. Do patients come, let's say an average patient, I'm using the word patient, I think you said member. Do members come to you for a window, say after acute diagnosis, or is it, do you have long-term members?
Yeah.
How does the plan work?
Yeah. So, a lot of this all started around just cardiac rehab. And so
Yeah.
we started in that space and we work in that space still. But then we started realizing, oh my gosh, we can address somebody with diabetes. We can address somebody with just simple hypertension. So people come to us as an individual, because they can come to us directly, or they come by way of their physician, cardiology, name whoever they're connected with. And so they become a member through us. But we're fully connected, by the way, with their physician through EMR and everything else. So patient is not left adrift to a third-party vendor that's not connected. So we're fully connected, fully integrated, so that that patient's outcomes are tracked and assessed throughout. So they'll get a blood pressure monitor, a remote blood pressure monitor, a remote scale, all the things that are necessary for us to track what their parameters are on a daily basis.
And just to reiterate, you're not just in your regional area, but you have a reach across the United States.
We're virtual. So yeah, so we have private practices that are working us from California all the way out to New England.
Do you work business to business or business to consumer? Do you work through clinics, say, and the clinician might say, hey, you might benefit from this?
Yeah, so right now we are specifically working on the clinic side, but we are engaging fully with employers, and also, as I mentioned to you, we're engaging with government entities as well to see how we might be able to assist in that realm too, from a CMS perspective.
Yeah, and since launching, how have things as a business? How have things been going?
Amazing, right? And this is the fun part of it, is because, and I always reference one of my first members that I talked to was a 67-year-old AFib patient who thought his life was like over. And when I first engaged with him, he said to me, he goes, "You must have the greatest job in the world." I'm like, "What's that?" And he's like, "All you get to do is you get to call people and motivate them, get them pumped up and fired up to go make changes in their life." I'm like, "That's great. I'm glad you received that as such." And so for me, having that engagement with patients and people, just individuals coming, everybody wants to have that conversation. Right. The challenge though is, do they have the willingness to want to make those changes? And so that's why our success has been big and different, because we do the psychology side of things as well as the physical, in order to have the whole person care all at once. So there isn't a single point of reference that we're working on. We're working on the whole person. And I think that's where we're making the biggest difference.
That's what, and that maybe also, would you say that's what makes you different than other approaches that have been perhaps less successful than yours?
100%. And even so, we have an app where we use AI to manage our data and everything else, but we're a people-powered organization. So you're going to talk to a health coach, you're going to talk to a nutritionist, you're going to talk to these people on a monthly basis. You're going to go to classes. You're going to be engaged in a community setting where you're actually attending. One of our psychologists or one of our health coaches might be doing a session on a Thursday afternoon about nutrition from 5 to 5:30. So you jump onto that, and guess what? You're on there with 17, 18, 20 other people from across the country. So you're engaging with those individuals too. So you now become a larger part of a community and you feel connected. And what's interesting, Phil, is one of the biggest things that I just learned from a physician a couple of weeks ago. When we look at social determinants of health and the biggest challenges for people being healthy, I'll put you on the spot. Do you know what that is?
I think people underestimate socioeconomics. Is that what you're saying? Or how our environment affects our health? Is that what we're saying?
How our environment, all of that stuff is important. But one of the key drivers for poor health is being lonely.
I've been hearing about a loneliness epidemic in the United States, despite all this. You and I are connecting and social media. Yep. But I've heard this.
Yeah, because in particularly, so we're working on a number of rural healthcare initiatives. Like, how do we get out to these rural communities that might not have a hospital, closer than 2 to 3 hours away? So the whole idea is that these individuals, they feel alone. Like, well, then all right, if they're alone, they're just going to say, it's easier for me to take that cookie. It's easy for me to not do anything.
Yeah.
And then what sets in? Anxiety, depression, all those things couple on it. And so when this physician said loneliness is their biggest social determinant of health in his area, I'm like, wow, that is just that shouldn't be. Because, I mean, look at us, we're across the country, right,
Yeah.
from each other, and we're connecting. I feel connected with you, right?
If I had to, if I had to guess, I would have thought you were going to say who we surround ourselves with, like other
Yeah.
people's health, say, or wealth that we surround
Oh, yeah.
ourselves with. Loneliness was a big factor. That's amazing.
Loneliness a big, of course, loneliness, and obviously the other things, right? I always tell my kids, show me your 5 closest friends, and I'll tell you who you are, right? So we always do that too. But and that's the thing. You want to surround yourself in circles that are going to make you become the best person that you can become.
What are some challenges that, as a company, you guys have had to overcome or work through?
Ignorance, and I mean that in a good way, but
Okay.
ignorance and adoption, right? And well, the greatest evil of all is money, right?
Yeah.
Because people, providers, services, they're like, we don't want to take on lifestyle modification because there's no way for us to get paid for it.
Yeah.
But then we usually come back around and say, nope, we figured that model out too. So anybody that we partner with from a healthcare perspective, they all get reimbursed. This is fully covered by CMS. So we figured out all the payment codes and everything else. We do all of that. And so people get paid. So rest assured, everybody can make money. We're not looking to take money away from anybody. The whole idea is how do we partner? How does industry, how do providers, and how do healthcare providers from our perspective work collaboratively to say we need better outcomes for these patients? Because what we're doing right now truly is not working. We know that. And you know that. You see that every single day in your practice.
Yeah, I was thinking, as you were talking, I was thinking that I actually lean into this, that some of the frustration we're feeling collectively with healthcare and health insurance, I use it as motivation to be an advocate for my patients. And I've been joking with other guests that I kind of, I tiptoe around politics. I don't really go there in the medical office. But what I say is that regardless of where someone stands, I think we can all agree upon that our healthcare needs to adapt and evolve. And sometimes when I'm feeling a little feisty, I'll say, it doesn't seem like health insurance is looking out for us. And so the solution is that we need to look out for ourselves and our family. And I try to use some discomfort to motivate for some change, whether it's eating better, reaching out to people like you, or maybe you and I talked earlier about using the word movement instead of exercise because it's maybe a little less intimidating, making some change.
Yeah. And making some change. And the big driver is finding what is most important to them. So when we go through our behavioral reviews with individuals, right, we want to be able to ask a question like, all right, so let's say you're 65, you're 250 pounds, 280 pounds, but you really should be 180. Mm-hmm. Okay. Do you want to change? Nah, I don't really want to work out. Do you have children? I do. Do you have any grandkids? Not yet, but I'd love to see some. Okay. Yeah. Well, what if you're not around? What if you're diabetic? What if you can't walk? What if you can't, does that drive you? And it's amazing by putting that carrot and the stick out at the same time. Wait a minute, I can't see my grandkids down the road. Well, that's horrible. I want to see my progeny. I want to see what does my future look like for my family. That's when we get those drivers. They just need that. They need that nugget to grab a hold of and say, yeah, that's what I'm working towards.
I call it finding your why. And for me, both individually and with my patients, I think of that why as a fuel. I ask people sometimes, what's going to get you out of bed one day, say when it's raining outside, when you don't want to go for a walk, or when you don't want to go to the gym, or when you don't want to, what's your why? Or I had a guy who successfully gave up tobacco. I had him I asked him to take the Christmas card with the kid's picture on it for, Christmas, put it in your cigarette pack. That's your why. You want to make a change? Yeah. Take a look at them every time you go for that cigarette. And he came back to me, and it was on him, not me, but he did it.
That's great. That's great. Yeah. It's so important for them to find their own why, because if I'm telling them to do something, I mean, everybody's told, all these American Heart Association, everybody tells people you need to work out, you need to eat better. You don't do it unless you have a purpose. Okay.
You gotta have a reason. Just like you probably had a fuel in college. That led me to my next question. Do you have a why or a sense of purpose as an individual and as a business owner for a driver, for the impact you're trying to make? Can you expand on that a little bit?
Yeah, I mean, I think, as simply put is I want to impact as many lives as possible, because from an AFib perspective, right? From an AFib perspective, these numbers are crazy, depending on which sources, but the ones that are, from the American Heart Association or anything, there's roughly about 6 million AFib patients in the United States. There will be 12 million in 4 years. Globally, there will be 60 million. Like AFib is like in the top 10 for most expensive diseases out there, and it's not slowing down. And so the technology and everything else, and we talked about this before, the technology to take care of AFib is great. It's out there, it's improving, but the outcomes for these AFib patients in some cases are not getting any better. So the technology is better, it's safer, and all those other things, which is great. But when it comes down to coupling all those technologies with lifestyle modification, that's where we see the greatest outcome. So for us is to say, we need to get this moving in a much larger way. So this doesn't look like, because I'm not asking people, as you had mentioned earlier, I'm not asking people to put like seed oil or, whatever types of, or onions on their feet or anything crazy, right? I'm just simply asking, just move, do something different, right? And it's amazing how much of an impact that has on people's lives. And one of the things too, which was surprising to me when I partnered with my partners in Nudge and started to see some of the data come back, we go out and we connect with these individuals to address their hypertension, diabetes, obesity, you name it. But the first things that we see drop are depression and anxiety scores.
Love it.
In huge ways. And then now all of a sudden these people say, well, I'm not depressed anymore. I'm not anxious. I'm going to go out for my walk. Holy cow. I didn't realize, shedding a few pounds or making better choices of whether or not I'm going to have a carrot and some celery sticks versus a Snickers bar.
Yeah.
I mean, it makes a big difference.
It's subtle, but it makes a difference. I joke. I joke with my friends sometimes. I like to exercise. Not everybody does. And that's okay. But I tell my friends, it's not like I'm trying to get people to bench press. I just want them to move more. Like whether that means fly fishing or dance with your partner or, I ask people a lot to get on the floor with your kids. I've got guys who are office workers with non-traumatic low back pain. And I'm like, just moving more, rotate, reach overhead, do stuff, twist, move laterally, movement.
And
also when I address depression, you touched on mental health. Movement is just critical for life. I think that's what we're both saying.
And that's it. I mean, it doesn't. I mean, now I guess I'll argue, and you probably say the same thing. It's like we all know from a male perspective, and even from a female perspective, like lifting heavy weights is so important, right? So lifting some level of weights.
Maybe a little personal, but I had this moment where I realized like how much the deadlift overlaps with. I had a patient, and I was just talking to him about exercise. And a deadlift, whether you use dumbbells or a barbell, if you just turn your hands to face your body, so this way, if you want neutral grip, that's your position when you pull your pants up when you stand up from the toilet. And when I have older clients, we're talking about independence. You want to be are generally my patients. A lot of my patients, they're a lot of them are ranchers and they're agricultural people and they're independent and they're feisty. I'm like, you don't want people to tell you what to do. Like, just these are life movements. Picking up, you will always have to pick up a box, pick up maybe a partner, maybe a baby, but picking something up off the ground, putting it on a shelf. That's just. Yeah. It's not about biceps and abs. It's about movement. It's about self-reliance is a word I like to throw at them a lot.
Yeah. And what's interesting, I heard this statistic from a friend of mine who's in healthcare and health and wellness as well. And he framed it differently to me there a couple of weeks ago. He says the biggest issue for elderly patients is obviously falling. Yeah. But they don't fall because of brittle bones. They fall because they have no muscle structure. And so if they had just, when they were 60, lifted a little bit, built a little bit of muscle, all of that carries over. And then you have less falling. You have less broken hips. That's where, a lot of, both my grandparents died because they broke their hips, right? It's just like, those are bad situations, right? So we can avoid those simple things by doing just the basics.
Touching on the same things with your business and my approach in a clinic setting of, I try to have people take ownership of their health, and I try to get them to show some initiative, and rather than being on autopilot, so to speak. And it's not a guilt trip, and it's not for me. It's for that grandbaby that you want to see. It's for things that you want to do with your life and being in control of your life. That's some of the stuff I try to preach to them.
100%.
Yeah. Talk to me about, let's bring things together as a business. How does the future look for Unlimited Heart? How do things look ahead?
Well, it looks amazing, right? And here's why. As I mentioned to you earlier, there's a lot of changes that are going on with the industry. A lot of changes going on with CMS. Literally just since October of last year, I'm just looking at my computer here. There's probably like 4 or 5 different CMS initiatives that have been rolled out that are talking about integrating lifestyle modification into the private practice, focusing on, how do we do this in rural health communities, right? Like really getting all of these people, back to your word, moving in the right direction, because we know that's going to have the greatest impact on the cost of care down the road. And, right now it's scary because I look at what my wife and I are both healthy. We're young individuals. Our healthcare just went up by 36% this year, and we get it through her company that she works for. But I'm like, oh my gosh, like that's even before any of us are sick. That's ridiculous. Like we can't afford that. Nobody can. And so that's why I fundamentally believe that every body and every person can become a center of excellence unto themselves, and then it's from that center of excellence that they create for themselves that they'll be able to reap the rewards for long term.
That's awesome. Jim, where can I want to thank you for spending some time with me today.
Thank you.
Can our audience go to learn more about Unlimited Heart? health and wellness, where can they find some more information?
Yeah, you can go to unlimitedhearthealthandwellness.com to find out more about the business and everything else. And then if they want to reach out to me too, you can reach me at jimkaveney@unlimitedheart.co.
Awesome.
And the book,
Thanks.
shameless plug, the book is available on Amazon.
Yeah,
And,
go for it.
and we have received, I'm proud of this, we've received 10 book awards for being the best memoir and best business memoir across the world.
Well, there, you just sold me. I'm going to have to check it out. I really appreciate it, Jim. Best, we'll put those links underneath for our audience. And I just want to say thank you again for spending some time with us, and best of luck to you in the coming year.
Phil, thank you so much, and all my best to you as well.
Thank you, Jim.